Hey guys, happy Monday. Just wanted to pop on here real quick and touch briefly on tick bites because I've gotten a few calls from my patients on this in the last 2 weeks. And so that's usually where I get my ideas is from what is going on in the community and with my patients. Ticks, first of all, will spread germs by attaching to the skin, burrowing their little head in and feeding on a person's blood, which is totally disgusting, but that's what happens. So that's step one. The risk of Lyme disease, which is what everybody gets panicked about with tick bites, is very low if the tick been attached for less than 48 to 72 hours. Finding an engorged tick on yourself is definitely more high risk. So finding one that looks like it's just full of blood, that is more high risk, and so you want to talk to your pediatrician about that, okay? Make sure that you make tick checks a daily part of your routine, especially if you're going to be out in wooded areas at all or places with a lot of trees because they can drop down from there. So checking, around the ears, all over your child's hair, waistbands, just areas, do daily skin checks for the kids, okay? Also, the big question is, what are we looking for if your child does have a tick bite? Okay, so after you remove it, we are going to be on the lookout for any type of red rash that develops around that area. Like say the tick was on there and you're like, oh yeah, that tick surely attached this morning and I got it off by the end of the day. So what are we going to look for now? You're going to look for any type of big rash to develop. So like a red circular rash. It kind of looks like a target is the best way I can describe it. It's red and circular with like a white clearing. So you're kind of looking for that over the next month after that tick bite. And so if you notice that show up, you definitely want to talk to your doctor about that, okay? Sometimes we will give an antibiotic before any symptoms develop as a preventative for Lyme disease, and there are very specific situations where we are going to do that. So it depends on, number one, how long the tick has been attached. Again, if it's a very short time period, it's unlikely we're going to give a prophylactic antibiotic. But if we have no idea how long that tick has been there, it's possible this tick has been attached for like 2 days. We just really don't know. Anytime we are dealing with an unknown, we get a little bit more, hey, let's do a prophylactic preventative antibiotic to be safe. Also, if the tick is looking very engorged as well, like it's been feeding for some time, that's going to be a concern too. So another big factor is, where were you when you got this tick bite? Were you just, in Carmel, Indiana, or were you in like a highly endemic area, which we use the CDC map to help us understand where Lyme disease is most prevalent and where our most dangerous ticks live, essentially. So north of Carmel and Indianapolis is kind of a higher risk area now, according to our local infectious disease experts here. So if that is the case and you talk to your pediatrician about all these things I just brought up, prophylactic antibiotics will typically start within 72 hours of taking that tick off. And that's only if we meet certain criteria. It is a case-by-case basis. So if you have any questions, make sure you talk with your pediatrician. Okay, guys, have a great week. Bye.